Welcome to the BizBox Hospital System 8 training video. In this presentation, we will discuss the primary functions and tasks of the nursing department that are important on the hospital process. Here are the topics to be discussed. Tag for May Go Home, or MGH Clearance. Untag for MGH Clearance. Tag as May Go Home. Make sure that you pay attention and take some time to practice before doing the said processes. This presentation will discuss the process of tagging a patient for May Go Home clearance. This process is intended to clear the patient from any transactions that are still floating, or not yet served, or rendered in different departments concerned. When enforced, this is also the first step for possible patient discharge processing. On the nursing services, select a patient on the list, then click Tag for MGH Clearance under the Subcomponents Explorer window, or from Subcomponents pop-up menu pad. The list of departments that are subject for notification of MGH tagging will appear. Put a check mark on the chosen department, then click Notify to continue, or Close to cancel the process. The password validation entry will appear. Input your user code and password, then click Accept. You will notice that the patient is successfully tagged for MGH clearance if it has an orange status. If the setup for MGH clearance is enabled, the untagging will also be activated. If you have committed some mistakes in the tagging process or any other reasons, this process might be helpful for you. On the nursing services, select a patient that is already tagged for MGH clearance, or the one with orange status, then click Untag for MGH Clearance. The Untag for May Go Home clearance window will appear. Specify the reference date and the notes or remarks if applicable. After that, put a check mark on the department you previously notified when you tag the patient for MGH clearance. Click Untag button when you're done, or if you want to cancel the process you can just click Close button. Key in your user code and password on the password validation entry, then click Accept. You will notice that the patient will have an active status that is represented by a green color. That means that the untagging process was successful. If the MGH clearance setup is enabled, the patient should be cleared before he can be tagged as MGH. But if the setup is disabled, the patients who have active or green status can be directly tagged as MGH. In the case of this video, we will discuss the process of MGH tagging if the setup for MGH clearance is activated. On the Nursing Services module, select a patient that is already cleared by having a white color status, then click Tag as MGH under Subcomponents Explorer, or from the Subcomponents menu pad. Please take note that in patients with transactions that are not yet rendered or still floating for that matter, cannot be tagged as May Go Home, especially if MGH clearance is not enforced in your hospital operation. The Inpatient May Go Home tagging window will appear. Supply the necessary information to all the mandatory fields, that includes the following: disposition and admission result, initial impression, patient status, and discharge diagnosis. Click Tag as MGH when you're done, or if you want to cancel the process, click Close button. Input your user code and password on the password validation entry, then click Accept. Notice that the status of the patient will turn to May Go Home, that is represented by the color yellow. Since the patient is now tagged as MGH, you can no longer request for items or services, and post charges to the patient's account. Here are the things to remember in the Nursing Services module of the BizBox Hospital System 8. The hospital's policy will dictate, if they will implement the tagging of MGH Clearance. The patient should be cleared from all hospital transactions, and tagged as may go home for him to be successfully discharged. Thank you for viewing, and we hope that this video was helpful.